Assalamu alaikum and hello everyone. Thank you for this very important opportunity to speak to all of you today. I'm deeply honored and I'm really sorry that I'm not available to come in person. When I was called to deliver a session here with all of you, I knew I wanted to talk about something new within the public health sector. Hence, I've chosen to speak on planetary health. I aim to walk you through planetary health, and maybe this can be the start of more discussions and collaborations. As we walk through planetary health, there are 4 areas that I would like to touch upon: the case for planetary health, introduction to this new topic, challenges to planetary health, and planetary health post-COVID. So how is health produced? We may think of health being created within a hospital or a medical care complex, but in actual fact, the medical care system only contributes to around 20% of the determinants of health or its creation and improvement. If you look at this pie chart, more than half of the pie, in fact 75%, is attributable to social and environmental factors. This shows us that the business of health creation should not only be focused and concentrated in the medical care and clinical industrial complex. We need all professionals, all disciplines and sectors to work together towards health improvement, as now we have seen with COVID-19. Hippocrates, the Greek physician we take our oath upon, the father of Western medicine, had this idea of health emanating not from the healthcare sector per se, but from the non-healthcare sectors. Although I would argue that every sector could be a health sector. There is a lesser known text of Hippocrates beyond the oath, entitled Airs, Waters, and Places. Here, he was instructing medical students to study the seasons, the hot and cold winds, the properties of water, the urbanization and designs of cities, even way back then. It was already very clear that the physicians of the past and the future will have to be concerned about the social and environmental factors that ultimately drive health and generate diseases. So in 2014, a group of scientists came together, public health experts, and wrote a commentary in The Lancet, introducing the idea of expanding the ambit of the health sector from public health, which is the health of people, to planetary health, which is the health of both people and planet. It is really a recognition of both the gains that we have achieved in public health over the past century. We have added around 25 to 30 years in the average life expectancy of the world, but we have achieved that accomplishment most of the time at the expense of the planet. Added to that, the quality of life is affected by issues related to planetary health. That is why there is a call to really embrace not just human health, but also planet's health, and thus planetary health was born. Here you will see it's a shift of mindset from public health to planetary health, because our patients now are not just people, but also the planet as well. There is an estimate that around 25% of the diseases of the planet emanate from environmental factors, from toxic pollution, air pollution, high diversity, biodiversity loss. The list goes on. This is really the backdrop from which planetary health was conceived. With the gains in healthy life, the life expectancy that we have achieved, we have reduced mortality for many diseases. Child health and maternal health have greatly improved, especially over the past 50 years. What happened is we have created different forms of pollution. We have destabilized the climate. We have altered a lot of the natural flows in our ecosystems, whether they're the flow of elements or even the flow of people because of technology and transport. We've seen all these demographic shifts. Consumption patterns have been altered over the past century, and all of these are contributing to the global burden of disease. For a period of 200 years, thereabouts, we have really increased water use. We are overusing our water resources, and there is discussion and talk now that maybe the next World War will be about water, not land. We're already seeing a lot of it also related to fossil fuels. I put in this slide because it's an interesting one, and it may be a familiar graphic for you and those who studied or are interested in geology. There's a scope and this concept of the geological timescale. The Jurassic period is way over the value of the dinosaurs. It's more than that. The past 10,000 years is basically the Holocene period, the epoch where humanity has survived as a civilization. There is a new suggestion, which is a call to calling the current 21st century people as Anthropocene, again, because of the anthropogenic nature of the changes that we're seeing. What this means is that humanity now, us human beings, is the biggest force that is changing the face of the planet. All these activities are resulting in enormous damages to human health, whether it's climate change or undernutrition due to crop failures or water use. As we pollute our water resources, then our fish stocks get depleted, water becomes poisonous when we consume them, or drinking them is also unhealthy. And even our soils now are being pumped with a lot of artificial compounds that disrupts the natural cycle of elements in nature. These are the health costs. Planetary health damage points to about 50,000 deaths annually due to climate change. This, we know, is a huge underestimate. Around 150 million people will be at risk for climate-sensitive malaria in the years to come. $30 billion in health costs annually is predicted due to climate change. Again, thought to be an underestimate. We are now very afraid of COVID-19. We've gone through 2 years plus of really a roller coaster ride. The health impacts are clear, and the consequences on the economy are also evident. That is a valid concern, but long-term climate change is also going to push us not just into debt, but a lot of economic consequences that will disrupt our societies in the long run. Yet, at the same time, it has been estimated that an investment of approximately $20 to $50 billion annually could substantially reduce the likelihood of future pandemics through health system reform, more effective early detection measures, and biodiversity protection. We must remember that 75% of pandemics are zoonotic in nature. Now that bill, that prevention bill, is only about 10% of the COVID-19 bill to the end of January. So it's even higher now, the COVID-19 bill. So the report commissioned in the Lancet and supported by the Rockefeller Foundation launched this concept of planetary health as an international and interdisciplinary field that is required for us to find solutions to the complex web of problems we have that will affect health. There's actually a debate whether planetary health is really a new field or a new discipline. Is it a novel policy framework? Is it a different kind of moral imperative or a unique scientific paradigm? Or is it just a sexier communication strategy to communicate health to millennials? I think it is all, but what is important is that planetary health is a mindset and philosophy. It is an integrated approach and a unified vision that brings together the health of people and the health of the planet. That is how I usually simplify it for everyone I meet. The late Professor Anthony McMichael is an icon and pioneer in climate health and planetary health from Australia. In the early 1990s, he was already urging the health sector to lift its gaze to bigger ecological horizons. This will require a radical extension of the public health agenda. It will require new forms of professional training in environmental health, but also every professional and in every discipline working on preparedness to base policy advice upon predictions and foresight as well, in addition to empirical data. A way I like to see it is that all these different fields are just looking at the same elephant, but from different sides. A health person may see the zoonosis, the leaping of a virus from animal to human. But a planetary health expert may look at land use change or forest destruction and how it provided the breeding ground for zoonotic infection. So we're really trying to address all the same problems. And it's important we tackle this problem from different angles so the collaboration becomes critical. The state of health today faces three main challenges: imagination challenges, research and information challenges, and governance challenges. And this is all clearly described in the 2015 Lancet report on planetary health, which I encourage everyone to read. It brings about all the different challenges and how we will need to unpack all of these and bring them together. Planetary health is about the management of our home and the services we take from it. This framework is obtained from the Millennium Ecosystem Assessment that was done from 2001 to 2005. What happens when we destroy the ecosystem, when we destroy the planet? The damage to those ecosystem services lead to negative health impacts. How does it impact health? The escalation of human pressure on the global environment has led to environmental changes and ecosystem impairment. And in turn, we get the consequences of climate change, ozone depletion, forest clearance, and et cetera, and et cetera. And we've seen this happening even here in Malaysia. One important piece of research in Malaysia by Crops for the Future, led by Prof. Said Azam, on the quality of rice found in Malaysia, and the results showed that the nutritional value of the rice is much lower compared to before. In other words, you get the carbohydrates, but not necessarily the nutrients and the micronutrients. Prof. Said has a very crude way of describing it. He says that you have children who consume rice, consume the carbohydrates, and they become bigger and fatter, but they don't become more clever. So there are consequences on developing brains. So how do we look at health through planetary boundaries? So let me take a little time to walk you through this slide. And this slide shows the planetary health, or rather the planetary boundaries. The planetary boundaries were described by Johan Rockström from the Stockholm Resilience Center, where he described 9 parameters that can be measured, where these 9 parameters will provide the safe operating space for humanity, as long as they are not transgressed. It takes into account land system change, stratospheric ozone depletion, carbon dioxide levels, of course, and many other factors. And with this, we have been able to map out planetary boundaries in almost all countries. And for those who are interested, please take a look at this in more detail, and also look at the Leeds University Good Life Index that has a further description. So layered upon this is an economic model for the planetary boundaries. So Kate Raworth from Oxford wrote a book called Donut Economics. The way donut economics works is that to look at the planetary boundaries framework and turn it into economic theory, challenging all economic theories and challenging the use of the GDP as a measurement of economic growth. If you look at this, there are two layers, dark green. One is the ecological ceiling, which is made of the planetary boundaries, but equally important is the inner ring, which is a social foundation. Now, we know that we cannot achieve social foundations without activity, and therefore we'll be naive to think that we have to stop everything and that we'll be fine. No, we won't. Developing countries, lower income countries will struggle. But what we need to do is keep an eye on these boundaries to make sure that we try to minimize impact, minimize damage. The whole will get bigger if your planetary boundaries are violated and your social boundaries are not then fulfilled. So it's a very interesting concept. It's been really widely regarded now, and there are also models around mission economics. We don't want people, especially poor people, to fall into the hole. So how do you make the donut hole smaller? First of all, you pay attention to the boundaries. Second, you can do some things at local level. For example, in Amsterdam, they've turned it into a donut city, consciously looking at sustainability, environmental protection, taxes for environmental damage, and so on and so forth. And it's very interesting that it has also been embraced by the people of Amsterdam. In Malaysia, my colleagues and I are working also to pilot similar approaches, and we may be starting this quite soon in Ipoh. So looking at this graph again, the three countries that are portrayed here, you will see that Malaysia has violated a lot of its planetary boundaries, and this will come at the expense of health. And therefore, there's very important need for the health ministry and other ministries to start working together to see how we can protect and improve some of these data and indicators that are in red. On the other hand, let's look at Vietnam. It's probably the closest to becoming a donut. And it has really been able to manage its planetary boundaries. And it's not doing so bad on the social floor as well. So, we have to figure out what did they do right that we can learn from, and how do we then help them as well as they rapidly scale up and grow to make sure that they don't violate their planetary boundaries. So let me move next to something very, very important for planetary health, and that is climate and health hotspots. In Southeast Asia, many would describe, Indonesia, Philippines as the supermarket and 7-Eleven of climate disasters and crises. So we have a lot of colliding threats hitting us at the same time. You can have a pandemic, you can have, a cyclone, you can have flooding, all these different threats happening at the same time, haze and so forth. And this is a big challenge for us in this region. Kiribati is an island in the Pacific. It is probably the first country to disappear due to climate change. I had the opportunity to meet its premier and its people. And the country is already exporting, packing and exporting their artifacts, their history to another location. They bought land in Fiji. They also have plans and discussions with other countries. So imagine if we are in the same situation. In fact, there are cities in Malaysia that are already at risk. By 2050, many of the cities on the coastal areas of Malaysia will be underwater, and this will also affect some hospitals. This is real. It is happening. There's so many examples around the world as well, so much so that Jakarta has to move its capital because it is sinking. Climate change can have tremendous health effects on us. We see now dengue rising in greater proportions, the resurgence of malaria, tuberculosis, and so on. Migration, human health, and global environmental change are all interlinked. Carbon emission is also a very important factor. They lead to diseases, deaths, and pollution. There are so many studies linking energy use and health. Whether you are using renewable energy or coal, they have health consequences. Are we then ready for a hothouse Earth? Think about where you work. The hospitals, clinics, are they climate friendly? We have to do something about the way we live each day. At the Conference of Parties 26 or COP26 in Glasgow last year, an important initiative led by Healthcare Without Harm called for the race to zero in healthcare, where hospitals committed to zero net carbon by 2050. Only one hospital in Malaysia signed up, and that is the Sunway Velocity Medical Center. And we are trying to help them now to design the program and the strategies to be net zero by 2050. The Global Pathfinder report has outlined 20 countries on performance in COVID recovery. Malaysia is mentioned favorably within that list. But we have not seen and we cannot imagine the impact of waste from the pandemic. How are people disposing their masks? How much single-use plastic is being used? How do we find a balance? I'm very proud to share with the whole world that Malaysia's vaccine program is a green vaccination program, at least in terms of its strategy. Now we need to implement and show that it can be done. At my previous job with the International Federation of the Red Cross and Red Crescent, we conducted large operations in Cox's Bazar in Bangladesh. And for that, we mounted a green response. Everything we did had to come from a green perspective, from our supply chain, procurement, how we manage disposable, how do we offset carbon, how do we look at recycling? And it shows how even in an emergency response, it is possible to have a climate-friendly planetary health response. So how do we then learn from COVID-19? How do our habits now change? Do we still drive one car per person or park and take the LRT or carpool? It requires a policy from the government to look at public transport and how it links to health and our utilization of carbon. It is a Ministry of Transport and a Ministry of Economic Planning and a Ministry of Finance issue as much as it is a Ministry of Health concern. There are still a lot of climate hazards occurring during this pandemic, as evidenced by our recent devastating floods. How can health systems incorporate climate protection? It is not impossible. It is about understanding the linkages. When you see a patient, see the patient in total. It needs a universal, high-value, climate-smart, pandemic-resistant response. And this is how we are looking at the 21st century planetary health-oriented health systems. Another problem that is linked to food is antimicrobial resistance. These are some of the projections of antimicrobial resistance that we expect to occur in the next 20 or 30 years. It is estimated that 75% of the misuse of antibiotics come from the meat sector, poultry livelihoods and livestock, because we are pumping chickens, cattle, pigs with antibiotics as if they are vitamins. And then we consume these animals that contain antibiotics and bacteria that are already resistant to the antibiotics. While still on the subject of food, let me also touch on food systems. I know many of you like your burgers, but what's in your burger? How much water does it take to produce a burger? What is the carbon footprint of that burger? Think of a figure for both the water used and the carbon footprint right now, and just keep that in your head. You got it? Okay, here are the facts. It takes about 2,738 say 2,800 or 3,000 liters of water to produce a burger, and double that for a Big Mac. The amount of carbon produced, or rather the CO2 produced for a burger, is the same as that produced by a car driving 24 kilometers. But it's not just about food that is consumed, it's also about food that goes to landfills. 40% of food goes to landfills. And of these 40% of the food that goes to landfills, 45% are still edible. It is estimated that the amount of food Malaysia wastes that goes to landfills can feed 3 million people 3 meals a day. Now, food doesn't just sit there, but they degrade and they produce methane, a highly polluting greenhouse gas. So on one hand, we have poor dietary choices made, reduced mobility, a more sedentary lifestyle, and what happens? It leads to higher non-communicable diseases, or NCDs. This means managing NCDs like diabetes mellitus is not just about insulin and other drugs. It's about food choices, mobility, behavioral choices, more public transport use, reduced emissions, can reduce risk of NCDs, but also lung diseases. But as you can see, tackling each of these planetary health issues needs a multi-agency approach and a different mindset. The fields that we practice must incorporate the 7 I's of planetary health: inspiration, institutionalization, integration, investment, information, innovation, and implementation. The Canmore Declaration, where people got together to really make health, planetary health, a driving force, this important approach that I mentioned earlier, that clinicians have an important role to act on. You cannot just be a doctor or a surgeon. You also have to look at the impact of the environment on your patients. COVID-19 has really been a dress rehearsal for entrepreneurial approaches to climate change. The business of planetary health is one of building a culture of health. COVID-19 has disrupted our global progress towards sustainable development and everything else that we might want to consider as progress. So it's time to revisit language and create a blueprint for planetary health futures. And I'm so delighted that the Prime Minister has endorsed that a planetary health framework needs to be developed. As we flatten the curves of COVID-19 or any pandemic, we need to flatten the curve of our ecological footprints. There are other big waves behind COVID-19, recession, climate change, and I hope that COVID-19 has set our paths and woken us up to a more planetary health-oriented future. We all have to be healthcare workers that both the people and planet need. Think about your role as an individual. How do we find our planetary health purpose? We have to look at systems thinking, collaborating more, and being committed to translating knowledge into results. Ultimately, we want to be in the service of everyone, especially the vulnerable and marginalized. We need to remind ourselves that we are really at the cusp of a huge opportunity right now. So what is the new normal? I do not even like the term new normal because I don't think we know what the new normal is. But what we do know is the previous normal was not good for us or the planet. We will have a next normal that we will need to go through and the next normal after that before we understand truly what any new normal might be. And certainly we need a normal that is planetary health oriented. Ladies and gentlemen, I've only given you a glimpse into planetary health. And I really hope this is the beginning of a conversation that we can continue, and many, many more conversations. And more importantly, that we can all approach health through a planetary health lens. My colleagues and I at the Sunway Center for Planetary Health and the Sunway University writ large will be delighted to collaborate with the Ministry of Health and with all of you listening today to further this important agenda, so that our future generations will one day look back at us and tell their friends and their families that we were good ancestors. Thank you very much.